Okay, so it's Thursday afternoon and I'm crazily done with clinic early to take my kids to see the Mystic play the Fever tonight. I'm so excited to see Caitlin Clark. Whoever thought I'd be pumped about seeing a WNBA game, but I am. Needless to say, I've gotten a ton of questions today about UTIs and vaginal estrogen. And should I use vaginal estrogen while I have a UTI? Why is it helping with my UTI, etc. On and on and on. So to try to address that, let's just remember what vaginal estrogen does. So it does a lot of different things for the vaginal tissue and the vulva in general. So first, it promotes collagen in the tissue. So collagen is important for keeping the elasticity of the vagina, the redundant rugae, the lengthening of the vaginal canal. So it does that. It helps with vaginal pH. It creates a more acidic vaginal pH, which helps promote the good lactobacillus species. The more good lactobacillus you have, the less likely you're going to have overgrowth of pathogenic bacteria. It also improves blood flow to the vaginal tissue. And with that, you get more nutrients and more oxygen to the tissue. It helps with tissue repair if there's anything. Also lubrication. So it helps with vaginal lubrication, which can minimize dryness and any pain or discomfort. So it does a lot of great things. In the scheme of UTIs, we really want to think about how it affects the vaginal microbiota. And again, with this acidic pH, the good bacteria are able to utilize that and proliferate, minimizing space for pathogenic bacteria that causes urinary tract infections. So if you have a urinary tract infection, please, please, please keep taking your vaginal estrogen. Why do I say that? Because with oral antibiotic therapy, think about what it does to your gut. It literally wipes out all the bacteria, which is great when you have a UTI that's causing crazy, miserable symptoms, but it's not great for vaginal bacteria, which is why there's such a high recurrence rate of UTIs within such a short interval of time, because we wipe out that bacteria. While vaginal estrogen does not give you new bacteria, it helps promote the growth of good bacteria. So definitely keep taking your vaginal estrogen while you're on antibiotics for a urinary tract infection. So that's kind of number one. Number two is there a difference about, if I apply the vaginal estrogen into my vaginal canal, on my urethra, in the vulvar vestibule? Sure, there's a difference about where you're applying it. And unfortunately, there have not been any head-to-head studies monitoring, only application of vaginal estrogen to the vestibule, only vaginal estrogen application to the urethra, or vaginal canal in comparison and looking at UTI outcomes. The short version is, the more vaginal estrogen you can put in the area, the better. All of that tissue has vaginal estrogen receptors, and the healthier the tissue, the less likely you're going to have any, small cracks or breaks or irritation. It'll decrease pain and also decrease any potential nidus for bacterial entrance. So I hope that helps. It's a little bit longer than normal. And again, I still get out on time to go cheer on Caitlin Clark, although I live in DC, but whatever. Have a good one.